Now we're going to talk about some priority health issues for Jackson County Public Health. Substance abuse and misuse by teens and adults is definitely a health concern in Jackson County. The health consequences of substance abuse can lead to poor health outcomes, including mortality, financial consequences, and crime. The two areas that we're going to look at today are focusing on youth alcohol use and misuse, and also marijuana use and misuse. Alcohol has great consequences for our youth, and we're going to focus on 11th graders, but looking at the data, we know that 20.9% of 11th graders have had at least one alcoholic beverage in the past 30 days in Jackson County. And that's compared to the state of Oregon, which is identified as having 16.8% of the 11th graders in Oregon have identified that they've had at least one alcoholic beverage in the past 30 days. Marijuana is of a concern just because of the culture in Jackson County and the grow operations that do occur here with recreational and medical marijuana. So for marijuana, 26.2% of 11th graders in Jackson County use marijuana in the last 30 days, and that's compared to 19.1% of 11th graders have used marijuana in the past 30 days. What we also know is that of the 11th graders, 70% of them have said it was either very easy or sort of easy to get marijuana. And this is alarming because when you have substances that are more readily available, they have easy access, there aren't those consequences for youth. Youth are more likely to engage in the risky behavior, and this is very true for also alcohol and marijuana. Tobacco use is also a concern in Jackson County. We have 20% of the population who are regular cigarette smokers. So in 2014, there were 8,634 people that had serious illnesses caused by tobacco. There were also 442 deaths that were related to tobacco use, and looking at what it cost our medical system in Jackson County, it was $881 million that was spent on tobacco-related medical care. And then also productivity losses are also measured, and so we know that it was about $70.6 million that was in productivity losses due to mature tobacco-related deaths in Jackson County. Also, we have one of the higher percentages of mothers who smoke during pregnancy. So 14% of mothers in Jackson County smoke during pregnancy. And what's alarming is that, or one of the risks and health consequences of mothers smoking during pregnancy is that it can lead to babies that are born at low birth weights, and so 6% of the babies born in Jackson County are low birth weight babies. And so as you can see, this graph shows that Jackson County does have a higher percentage of mothers who smoke during pregnancy compared to Oregon and also the U.S. Sexually transmitted infections have also become a public health crisis actually in Jackson County, but this is much like the United States as well. Our incidents of gonorrhea, syphilis, and chlamydia are all increasing in Jackson County, and in particular over the last year. Our gonorrhea rates, we had two spikes. Starting in 2013, our incident rate increased 384% from 15 cases per 100,000 population to 72.6 cases per 1,000 population. And then in 2016, we had another spike, and so now our rates are at 81.7 cases per 100,000 population. Syphilis has also seen very similar trends. So looking at 2009 to 2012, lumping those years together, our earliest syphilis rates were at 0 to 0.5 cases per 100,000 population. Then beginning in 2013 with the first jump, we jumped to that 0 to 0.5 cases to 3.8 cases per 100,000 population. And then in 2016, Jackson County had an estimated early syphilis rate of 8.3 cases per 1,000 population. And the graph shows the steady increase of early syphilis rate in Jackson County.